Good morning. We're sitting here in Noida, outside of Delhi, in India, with Grant and Louise Bentley. As you can tell, or you will tell when they start to talk, we're all Australians. So basically Australia has decided to invade Noida for the couple of weeks in order to record a course given by Grant and Louise on homeopathic facial analysis. What's the origin of the course, and basically what's it added to your practices over the last 25, 30 years as you've been developing this course?
I've been in practice for pretty close to 30 years, and Homeopathic Facial Analysis, or HFA, came across by accident, and it just came out of intellectual curiosity. It came from the idea that a number of earlier authors were talking about the interaction between miasms and facial features. Hahnemann continually stressed that the importance of the inclusion of the miasm into a remedy selection. Any constitutional treatment must include the miasm as well as the presenting signs and symptoms. I think there's about 100 different theories going around on what a miasm is. So what I then decided was, well, look, this idea of facial structure would be really important, as being able to understand what a miasm is before giving the remedy. If you could as Alan was talking about, that the miasm imprints itself on every facial feature, if you could understand how to read nature in that manner, you could understand what miasm to give before the remedy, and then you would fulfill that legacy that Hahnemann continually asked of presenting signs and symptoms and the miasm in that constitutional remedy choice. And so the whole thing kind of came about like that. It was a very slow process at first because we had to take pictures and compare and do all sorts of analysis, but eventually we ended up with a system that just works like a dream. And I think it's living proof of what Hahnemann was saying in the first place, that if you can get that miasm and the symptom totality, that remedy will work much more effectively and for longer than just symptom totality only.
What part are you doing and what part is Louise doing?
All right, the part that I'm doing, and then I'll hand it on to you because I'm hogging the limelight here, but the part that I'm doing is the technique of what HFA actually is and how to apply it. What I want to do is that I've learned a few tricks in this 30 years, and like with any profession, as you would know, you come out of college and you start to apply rigidly what you've learned, and you find that that doesn't necessarily work. There are tricks of the trade, but you've got to know the trade first. You can't just go to the tricks, that's just ridiculous. So, but there are certain tricks of the trade. So what I'm trying to do is teach a little bit about the trade itself, and then some of these techniques will involve what you do after a remedy is given, how to spot certain times of change, when to stay the course, how to choose a remedy. So I'm trying to give anyone who's interested a system that they can always rely on, that there's always a signpost every step of the way, no matter how complicated the case, no matter how much they're starting to get frustrated with it, they can always take a deep breath and say, no, hang on a minute, let's just go back to the technique of how HFA works and let's work our way through again. And it will always keep you in good stead. It'll see you through if you just keep following certain rules.
Yeah. And so the technique is there, and then Louise.
Okay, so you asked the question, what do we both bring to it? And we've had this discussion a number of times because we actually think in completely opposite ways, which is both useful and sometimes challenging. But the reality is Grant's very conceptual in his thinking, and he's very curious, and he doesn't leave any stone unturned. He will continually ask questions, why, until he works it out. And he likes to work things out by himself, and he's done an excellent job. And all of our colleagues recognise his strength in that area. But it has been commented upon that I have a structured mind, and that has allowed me to pull a lot of these conceptual details, which have all been true and validated in the clinic, into an orderly place so that others can follow in a more linear way. And so we decided when we were invited to do this course that because of our two different strengths, and because this system requires both points of view to bring it all together, that it would be a good idea that we took on those roles each, and not only we've put a lot of time into writing this course, we've put in 20 years of our knowledge. Grant's done it from this technique perspective, and I've done it based on the face itself and the linear steps that you take when you look at a face, how you look at it, what you see, how you allocate, how you measure, and then how you integrate that back into your miasmatic diagnosis. So they're the two different ways we work and think, but when you bring it together, it is actually quite dynamic.
And so I'm a young homeopath, or I've got many years of experience, and I'm looking to understand perhaps how I could learn something new or get another perspective on my practice. So why should I, or what will I get out of doing this course with you, practically speaking?
I think one of the main things that you get out of this is that next step. So sitting down there, taking a case can be pretty easy. I mean, what is it that you're ailing from, and tell me your problems. But organising it into a repertorisation, that can be a little more difficult unless you just keep in mind the information that you need to repertorise on. If you know what a case is comprised of, then you know what questions to ask in order to get that. But then it stops there. And I think what's historically happened is, well, okay, we've got our base, but now how do we make our remedy choice, and what do we do with it? And it's that next step that HFA takes homeopathy. So I think it's a valuable addition to people who already know how to practice, or at least already know the fundamentals. They don't have to change those fundamentals. In fact, we encourage that they keep to those fundamentals, but just add this at the end of it. It takes a little while to learn. I think it's Louise saying is that if you give us 3 to 6 months, we can give you a lifetime of success in the clinic. So it does take that little bit to learn it, but it's well worth learning.
So somebody watching this course or subscribing to this course will learn the technique and the how to take the photos, and will then be able to practice that, and we'll be always able to go back and re-look at the video, so that if they get lost, they can improve their technique. So in the course, will you be sort of giving them the do's and don'ts of taking photos, and the right and the wrong, so that they can go back and say, oh, you know, a little bit like doing a passport photo, there's ticks and crosses.
Exactly like that.
Oh, okay, so it's
exactly
very
like
practical.
I think you asked the other day, do you have to keep taking the photos? And the answer is yes. It's easy to think, let's cut a few corners. We all like to do that. Have a quick look, we'll work it out. Everybody's individual, and their facial features present with a combination, many different combinations. And so it's just like a case itself. You should never make any presumptions. You should apply the technique of homeopathy correctly, that is, look at the case in its totality and pull out the significant symptoms, and then work with those to match to the remedy. And it's the same with the face. You look at the face in its totality, you pull out the significant features, you match them to the miasm, and now you have your patient's miasm. You've got your patient's miasm, you've got your totality, you bring them together, and you look at only remedies that match that repertorisation that belong to that miasm. Instead of maybe having to look at between 20 and 30 remedies, because we do highlight that using general rubrics and modalities in particular is a really successful way of repertorising. But it does bring in quite a lot of remedies, and it can be a little overwhelming when your graph shows you 25 or 30 remedies. But the nice thing with the miasm filter is all of a sudden, because we have 7 miasms, you've got a 1 in 7 on that group of remedies, which makes it quite easy. We've worked with students for many years. Our college started in 1989, and not only have we worked with a lot of students in Melbourne, Australia, but we also got the opportunity to travel the world, and we put up an online course which reached more than 25 countries. So we've spoken to students at various levels from year 1 through to 20 years experience, and each of them has a different perspective, but all of them to some degree wanted something better. They felt they were struggled in some cases or some aspects of their clinic, and they've done this learning, what we call HFA, and the feedback's just been incredible, exactly the same as what we've discovered. We've just found that it doesn't matter who walks through that door, it doesn't matter how old they are, what complaint they have. Once you can do the face and the miasm and hear the symptoms and convert them into good general rubrics, you have between 1 and 4 remedies, you have at least an 80% chance that you're going to find a remedy that significantly helps that patient. Gives you great confidence, gives you a feeling that you know the steps you're going to take. And even if it goes wrong, and it will, you don't always make the right choices. You may have not picked the best rubrics, or perhaps the patient missed out telling you something important, or perhaps you didn't take the best photos, or you didn't analyse the face correctly, but you can always just start at that point again and very quickly find the right miasm, find the right remedy. And the cases that we've seen, particularly in the last 6 to 10 years, when the popularity of this method has started to become known around the world, people have sought out our clinic, and Grant in particular, to help them with extremely difficult cases, which aren't turning out to be so difficult at all once you can read the face and get a nice set of symptoms. And it's expanded our idea of what remedies are all about. We feel that we can work with between 80 and 120 remedies very comfortably, and each remedy might suit 100 different types, and it's really amazing to see homeopathy expand before your eyes. So it really is quite simple to learn, and it gives enormous confidence to the practitioner at any stage in their learning.
Is homeopathic facial analysis taught in undergraduate schools throughout the world, or is it something which was lost in translation? Which I hear that it came to you through your understanding of what Hahnemann's teachings were, what Alan had developed as well. So I know body language is taught in homeopathic colleges. Why not facial analysis?
I think that's a very good question. I don't have a very good answer for that question, but I think it is a very good question. I think one of the problems with HFA is perhaps people judge it very quickly. Maybe judge it a little harshly based on what it sounds like it is rather than what it is. Like any new idea, you get people who like to congratulate you and then other people that don't. And the people that don't, they haven't been on the course and they haven't done it. So I mean, they often give it a very hard time based on what they think it is rather than what it actually is. And just to take what Louise...
Homeopathy itself.
Like homeopathy itself. But just to take a little further what Louise was saying about how complete it is as a course to teaching you how to do facial analysis, the course actually takes you one step further than that as well, because it's not just, okay, this is how you select the remedy and stop. It's what happens when the remedy goes right and then starts wearing off. What happens if you get it wrong? What happens if they get sick in between? What happens if some cataclysmic event happens in their life and the remedy's not holding? When do we repeat? When do we stop and change? When do we stop the remedy altogether? All of these things that I think graduates, they haven't found their footing yet, and this will help them find their footing. Part of any new idea is that it is a bit of difficulty taking off because a lot of the teachers, they've found their footing, so they don't need to look at anything else. But for undergraduate that are just completing, they're setting foot in the clinic, they're seeing their patients, and now they're realising that this is not textbook. And you do need that help. Just something that's going to be there to say, where they can say, a patient comes in and says X, Y, and Z, and they can say, okay, I know what to do. I've been through that course.
So
I know that.
What I'm hearing is that you're going to, or you are assisting, and you have for many years, homeopaths who are looking for a more confidence in their practice.
Yeah.
You're able to give them, or what I say, remove a little bit of the confusion and create a little bit more confidence so that they're able to align themselves with their professional practice. Okay.
Yeah.
Well, what I'd like to do this morning is just to thank Grant and Louise for coming in.
It's our pleasure.
Any of you who are watching this video will be able to see a teaser of their course and also subscribe to their course. This is a course which is a lifelong course. It's something that you'll be able to access over the full lifetime of your practice. so that when you have questions, you'll be able to go back and actually say, well, what did Grant say in lecture 3 on part 2 of day 5? You'll be able to go in and re-listen, re-look, and to have a better understanding of this beautiful method that Grant and Louise have brought to homeopathy. So thanks again, guys.
Thank you, Dan.
Thank you.
And thank you for everybody watching this course, and we'd love to get your feedback on this interview and anything else that you get from the Homeopathic Facial Analysis HFA course that you will have subscribed to. Thank you very much.
Thank you.